This is the top 3 exercises for tennis elbow. It's also known as lateral epicondylitis. Lateral meaning the outside of the elbow, away from the body. Epicondyle is a bony part on the bottom part of your upper arm bone called the humerus, that all your forearm muscles on this side of your forearm are attached to. So it's tennis elbow or lateral epicondylitis. The first exercise that we do is this. People with tennis elbow frequently will have trouble gripping something because when they do, these forearm muscles are painful and they're inflamed. So what we do is stretch that lightly. So you take your arm straight out in front, elbow straight, opposite hand on the back of your, so on the affected side, so if I'm having pain in my right elbow is straight. With my left hand, I'm pressing down lightly on my right hand. And I should feel a stretch right through that area that's inflamed. 30-second hold. In the clinic, we do 3 times. So that's exercise number 1 is a stretch. Exercise number 2, what we do is you're going to go like this with a hammer. You can also use a dumbbell like this if you grab one end. In this case, we'll use the hammer. And you want to rest your elbow on something or just have your elbow at your side, and then you're going to go as far as you can one way and go back the opposite direction. This movement right here is called supination, and for people with tennis elbow, they'll frequently have pain doing that sort of movement. So if they're opening a jar or turning a doorknob, something along those lines, they'll have pain with that. So outside of the normal rest, ice, compression, elevation, once their inflammation is calmed down, and they want to strengthen it so that it doesn't return in the future, you have them do this movement. So lowering as far as you can one way, and then go in the opposite direction. So 3 o'clock, 9 o'clock, 3 o'clock, 9 o'clock. And in the clinic, we do that 30 times. If it's too light, we'll add a weight at the end. If it's too difficult, we'll have the person just shorten up their grip on the object or decrease the weight. So 30 times, that's exercise number 2. Exercise number 3 is a wrist extension. So what we do here is we grab a dumbbell or a weight. The forearm is resting on a mat. Bend the wrist down and then extend it back up. So right here we do 30 times, and we're using again those forearm muscles that are inflamed. So when we see somebody with lateral epicondylitis or tennis elbow, we want to make sure they're calmed down first. That's usually with ice, rest, compression, and elevation, right? Calm the area as much as possible. Get through that inflammatory process, the inflammation, the pain, and then when we're helping them rehabilitate, getting these muscles to fire again pain-free, these are the 3 exercises that we do. So this is a strengthening exercise. Again here, start really light weight, maybe even no weight at all, and then progress up as the person's able to tolerate that. Top 3 exercises for